Good afternoon, Sydenham and TEDx. And thank you for having me here. Healthcare is a very broad subject. It includes hospitals, it includes Ayurveda, it includes pharmaceutical companies, it includes medical device companies, medical equipment companies, dentistry, ophthalmology, so on and so forth. But today I will talk about hospitals because that's what I expertise in, and how hospitals are such an important part of the healthcare management system in India. How many of you have seen the movie Three Idiots? I guess everyone. So in a popular scene in the movie Three Idiots, the professor asks his students the definition of a machine. And Chatur Ramalingam, who is one of the most popular characters in the movie, replies. And I'm going to read it out. Machines are a combination of bodies so connected that their relative motions are constrained, and by which means force and motion may be transmitted and modified as a screen or screw in its nut or a lever arranged to turn out a fulcrum or a pulley about its pivot. कुछ भी समझ में नहीं आया. In fact, I could not even memorize this definition. I had to write it down and read it to you. But Rancho has a very simple answer. A machine is anything that reduces human effort. Simple and straight. Now, if you Google the definition of healthcare management, which is what I'm going to talk about, Google throws up another definition, and I'm going to read it out. So, healthcare management is a vital aspect of the healthcare system responsible for planning, organization, and supervision of healthcare services. Effective healthcare management ensures that healthcare facilities run smoothly and there is more. Patients receive quality care and resources are allocated efficiently. Effective healthcare management is critical to ensuring quality healthcare services, improving patient outcomes and reducing healthcare costs. 10 साल से healthcare में हूँ, लेकिन ये भी नहीं समझ में आया. So I had to actually write down this definition. It is so difficult. Let me put it in Rancho's words. What is healthcare management? So healthcare management is nothing but creating a system which will deliver good patient outcomes at an affordable cost and where the human effort is backed by technology. Simple. Just 4 things. One is good patient outcomes. Number 2 is affordable price. Number 3 is human effort. And number 4 is technology. That's what it takes for a successful healthcare management system. Now, we talk a lot about AI. We have AI for breakfast, lunch, dinner. Everywhere there's AI. In healthcare, we talk about telemedicine. We talk about video consulting. We talk about data analytics, data munching, crunching, all this jargon, and lots of complicated machines. But let me assure you that behind all this technical jargon is a humongous human effort by people who we don't talk about. And I am going to take these few minutes to, talk about this human effort, which is used and which is delivering quality healthcare and is so less spoken about. Let me start with some statistics. Okay, some simple numbers I'll throw at you. So, and that is simply to bring to light the current status of healthcare management in India in both infrastructure and economic standpoint. So, India has 0.6 beds per 1,000 population. आप अस्पताल जाते हो and everyone needs to go to hospital. So, India has 0.6 beds per 1,000 population. We need to build as a country 2.4 million more beds. 2.4 million more beds to reach a WHO recommended ratio of 3 beds per 1,000 people. Now, to build these 2.4 million beds, we need 2 billion square feet of healthcare space. So you can imagine the expense required and the gap that our country currently has. Now, if you look at the year 23-24, India will spend 87,000 crore on healthcare, on public health. This same number in 2014-15 was 37,000 crore. That means over the last 8 or 9 years, we have doubled that number as a country. So the needle is moving. But even after spending 87,000 crore, we would have spent just 2.5% of our GDP on health, our gross domestic product. If you compare this to other countries, Western countries like US, Japan, France, Germany, etc., these countries end up spending 15 to 20% of their GDP on health. So that is the gap. Now, does India have the intention to fill this gap? Can we actually build those 2.4 million beds that we're talking about? Yes. There is an intention and we have the money. We have a robust economy. And even the PM recently declared that, he's going to build some 3,000 hospitals in Tier 2 and Tier 3 cities. So, once we start ramping up for that 2.4 million beds, what is going to be the most important aspect to do this? And if you ask a forum, they will say technology, technology, technology. They will say infrastructure, infrastructure, infrastructure. But the fact is that technology can be bought, infrastructure can be bought, material resources can be bought. But what is required is manpower, people. So we need the people. We need trained people to actually go and achieve this objective. If we don't have trained people, those 2.4 million beds or whatever beds that we're going to build in the hospital industry is going to go waste. So let us look at some important people in healthcare. Let me just drill it down very simply. So the most important person, probably the doctor, the Sher Khan of the hospital, the most important man, the godly figure, the man who cures patients. India has 13 lakh doctors. And I'm sorry, but I have to kind of throw out these numbers to get to what I'm trying to get at. So India has 13 lakh registered doctors. That means we have one doctor for every 1,000 people. This is the WHO recommended ratio. That means we are okay. And in the recent, press conference in the Lok Sabha, our Union Health Minister, Mr. Mansukh Mandania, said that India has 801 doctor for every 834 people. That means we are better than the WHO ratio. That's fantastic. But here's the problem. 70% of India stays in rural areas and 30% stay in urban areas. 60% of these qualified doctors, 60% of the 13 lakh qualified doctors are in urban areas. And the rural areas only have 20% of these qualified doctors. So there's a huge influx. Obviously, there's a big paucity of doctors in the rural areas. So there's a huge influx of population from the rural areas coming to urban areas to seek population, which kind of increases the load on the doctors in the urban areas. That is the kind of load a doctor has. Now, I work with so many doctors and, I have personal relations with them. Being in the healthcare line, doctor obviously is our most important person. So let me just take you through a day in the life of a doctor, 24 hours. So he'll get up in the morning, 5:36 a.m. Then he'll go to the hospital. If he's a surgeon, he'll have at least 3 or 4 surgeries lined up. If he's a physician, he will go and visit 10-15 patients in the hospital. That's 3 or 4 hours. So 3 or 4 hours of his time, if he's a surgeon, goes in surgery. If he's a physician, will go in, going and looking at patients. After that, he will go to his OPD. And that OPD will go until late afternoon. Then he'll probably have his lunch around 3, 4 o'clock. Then again, he'll go back to his OPD. That OPD again will go on for 2 or 3 hours. Then again, he'll come back to the hospital at maybe 5, 6 o'clock or 7 o'clock and do a round to see patients that are admitted, newly admitted patients, critical patients. Amongst all this, he will have a plethora of documentation. So he'll be signing files, discharge files, documentation. And more so, he will also have to read and keep himself abreast with all the technological development, all the medical advancement that is going on, because the medical science is moving very quickly and a doctor has to stay abreast, with the medical science. So he has to read. So saying that, and one more thing. So he will be on call 24/7. So 24/7, he'll be attending calls. A doctor's phone will ring at night 2-3 times. Maybe the hospital is calling him seeking help. The doctors are calling him seeking help. The nurses are calling him seeking help. So this is how his day is overloaded. Now at this point, I want to talk about patient communication. So it is very important for the doctor in the hospital to talk to the patient. When a patient is sick, it is important to communicate with the patient and his attendant, because even if the treatment is going in the right direction, they have to be spoken to. I'll take an example. I was in this hospital, I was heading this hospital around 6-7 years back. I'll not name the hospital, but there was a critical baby which was brought in the ER. A 1-month-old baby was brought in the ER of that hospital, and immediately our neonatologist or senior consultant came to the ER and saw the baby. The baby was very serious, so the baby was moved to the NICU on top, the NICU. And in spite the hospital trying everything, the baby passed away. It was very sad. The senior consultant who was looking after the baby, the senior doctor, obviously was also looking at many other things. So he sent the junior doctor to inform the family. And obviously the father was waiting outside the NICU. The junior doctor just went and blurted out, "Sir, your baby passed away." And all hell broke loose. And understandably, he kicked the chair, punched the wall, and shouted and screamed. And there was a complete security situation that arose until the security and hospital staff got together and resolved and kind of calmed him down. Then the hospital staff spoke to him very compassionately and told him that, what had happened and under what circumstances the baby was brought, to our hospital, and, the chances were very slim. And he understood. He settled down. And, then all the formalities of the death were over, and he went away with the body of the baby. Now, if the junior doctor had, in the first place, been so compassionate, the violent situation would not have arisen. But looking at the load that the doctors have, is it even possible for them to, think or be emphatically, compassionate or passionate or empathetic towards the patients? It is very difficult. But even today in India, 9 out of 10 doctors do it. But it takes just 1 or 2 instances like this to, break faith of people's mind on the doctor. So that's how sad it is. So how do we support the doctor through technology? Now in India, there are various technologies. One is AI. So artificial intelligence will help the doctor if you can actually get that tool moving, and we more or less have that tool. It is a bit primitive, but it is there. So the AI tool will help the doctor in diagnostics, in documentation, reduce a huge load of the doctor. So AI is one thing. Second is robotic surgery. So there are many robots now in India. So what does the robo do? If a robo reduces surgery time, a robo has arms which can actually twist 360 degrees. If you see, a human arm can only twist 180 degrees, but a surgical robo, its arm turns 360 degrees. So the surgery becomes more accurate. There's less time. So yes, we are investing as India, we are investing in surgical robots, but there's a training required. The training has a duration of 3 to 6 months. And not all doctors actually have the time to go and invest time to the training. So though we have surgical robo, it will still take some time for us to actually get abreast with that technology. Third is, navigation technology. So while a doctor is operating on the operating table, he can see live reports and live stuff going on, which otherwise he would have to wait for. So that again reduces time. And then there is e-medical records. So I'm sure, if you go to hospital, you would have heard of e-medical records, electronic prescriptions, where the doctor simply punches down what he wants and a prescription is created. If he has made a template, then automatically that template will prescribe the medicines to the patient. That will then flow to the pharmacy and the patient can pick up the medicine, and that saves huge time. But again, we still have some time as a country, to implement that completely, because not many doctors are very well versed with EMR, and they still prefer to scribble on prescriptions which you can't understand what they're writing, but they still do that. So these are the few technologies that actually, that if we implement, and which we're trying to do as a country, is going to help us reduce the load on the doctor. Again, imagine with 2.4 million beds coming in, how are we going to manage the doctor-patient ratio with so many overloaded doctors? So that was the point I was trying to make. The second most important person in a hospital is the nurse. Arguably, nurse is probably the most important person, because the nurse is more visible to the patient than even a doctor. A doctor will see the patient maximum 10 times, twice a day, morning, evening. A nurse will see the patient 24 hours a day. So the nurse will, implement the medical administration plan, which is prescribed by the doctor. She will give him bedpan, talk to the attendants. She will do the sponging. She will indent the medicines. She will, so many things. So now if you look at India again, when nursing is concerned, we have 2 nurses per 1,000 people. 2 nurses per 1,000 people. The WHO recommended ratio of nurses is 3 per 1,000. So as a country, we are 1/3 short of this critical manpower. 1/3 short. And what is the reason for attrition? Why do nurses leave? Because nurses are offered higher salaries abroad. Why can't we match the salary is a different subject altogether, which can take hours. Because in India, healthcare rates are almost 1/7 to 1/8 of the rates that exist in other countries. We are so cheap. So looking at the kind of money that we get in terms of tariff, it is difficult for hospitals to match the rates that nurses get abroad. So that's one reason. So 50% of the reason for attrition is nurses who move abroad for a higher salary. Now look at the second largest reason. There is a course in India called General Nursing Management Course, GNM, which is 3 to 6 months. And people who opt for the GNM courses are not people who are looking at nursing as a long-term career. Now, because of paucity of nurses, hospitals opt for GNM nurses, because they need to fill the numbers. And 35% of the total nursing manpower in India is GNM, which has the highest attrition. So these are the two reasons why there is so much, shortage of nursing. Now, again, besides all the things that the nurses do that I spoke about, 35 to 40% of the time of a nurse goes in documentation, filling discharge files, writing reports, indenting medicines, so on and so forth. Also, a nursing shift at 8 hours. So, in a day, there are 3 nurses who will look at a patient 24 hours, 8 hours, 8 hours, 8 hours. Because of paucity of nurses, most of the nurses in India work 16 hours a day. So, they work 2 shifts. So, imagine working 2 shifts, having a load of 35 to 40% documentation, and obviously will lead to attrition. So, what do we do? So, the idea here is, again, try to automate their documentation. There are companies working towards automation. Hospitals like us are trying to get automation into place, but it's easier said than done. If you can get that technological automation for nurses where they are discharge summaries, files, and statutory documentation is automated, they save a lot of time. Another thing which takes a lot of time is, indenting pharmacy. So you will actually see nurses, if you go to a hospital at a busy time, you will see nurses, writing in files and darting around here and there with medicine in their hand, but they don't have a choice because they are implementing what the doctor says. So if a patient was admitted, he has to be given XYZ medicine. The nurse will have to go and get it and indent. So if we automate our indenting system, it saves a lot of time for nurses. Now I'd like to talk about the billing department, the most hated department of a hospital. Everyone thinks that hospitals are out to cheat people, and the billing department is the culprit. So it is commonplace, not in India, probably all over the world. But what is the root cause of this? 70% of India's population is insured or have some sort of a public or private insurance. But the balance 30% translates to 40 crore people who do not have insurance. So 40 crore people are going to pay cash. Now, when you have to dole out so much money for treatment, obviously it's very painful. And looking at, the income levels and, the kind of strata of people India has, it is not easy to go around and pay that money. So that's a big issue. Now, of the 70% who are insured, a large number have government schemes. So they have something like CGHS, they have Ayushman Bharat, they have PSIC, they have MPJY, which is the Maharashtra empanelment. And the problem is most of the larger corporate hospitals do not accept all these empanelments. So even these people end up paying cash. So and it's the billing department that faces all this wrath. Now, after COVID, the insurance penetration in our country rose to almost 50%. Before COVID, it was around 30-35%. Now around 50% or 55% of the people actually have an insurance to pay for the medical bills. But there is no automation of the claim process. So it takes 5, 6 or even 7 hours for a hospital to discharge an insurance patient. Why? Because when you're an insurance policy holder, you will first send a pre-authorization to the insurance company. The insurance company will look at a policy, then send it back to you. And then you get admitted after treatment. They'll again look at the policy. And only after they give the discharge authorization can the patient get discharged. And one insurance company has lakhs of people to kind of, manage the insurance with. So it takes 5 or 6 hours. Now, can you imagine the scene in a hospital, how chaotic it would be at that point of time? So, there are patients who are insurance patients who are not getting discharged and are occupying the bed and taking 5 or 6 hours to get discharged. And then there's patients who are going to get admitted and they're not getting admitted because there are no beds available, because the beds available are blocked by the insurance patients. And then there are people who are fighting around the bill. So it becomes a highly, highly chaotic situation. The discharge time in a hospital that is somewhere between, say, 1:30 or 2 to 4 o'clock is the most chaotic time. You see shouting, screaming, complaining, fighting, everything goes on. How can technology help? Automation of the insurance claim system, which is there across the world, but we don't have it. So we need to, but then we have different types of insurance. We have private insurance, we have government insurance, then we have GIPSA. So it is about getting all these insurance, together. And there's a body called Nat Health, which is a body which is a kind of a union of all the private healthcare operators, is somehow working towards this automation. So we're trying to get this claim automation process in place, because once the claim automation process is in place, okay, the discharge stats decrease, the bed turnover increases, and obviously you get more available beds to admit patients. Lastly, every hospital has a sales and marketing department. I joined healthcare in 2012 as a sales and marketing head. And my first question to the recruiters was that, what do I sell? Hospital mein kya bechna hota hai? What do you sell in hospital? And I soon realized, maybe 1 or 2 months down the line, that what you need to sell in a hospital is the doctor. The doctor is the product. So what does hospital do? Treats patient. So patients will come to the hospital for treatment. And how will they get treated? Their various ailments will be treated by a doctor of that specialty. So the hospital has to create awareness that, yes, we have doctors of this specialty in the hospital. So doctor is the product. Sounds very like a commodity, but yes, it's a fact. So now you see, you'll see various hospital ads, you'll see hoardings, billboards, you'll see newspaper ads, you'll see radio, you'll hear radio. There'll be a lot of online activity. So all this the hospital does to sort of market or create awareness that, yes, these are the doctors we have and this is what we are actually trying to. These are the clinical programs that we have. But what is more important from a technological point of view is just two things. One is a patient app. And very few hospitals have a patient app. So we are working on a patient app. So what does the patient app do? So if you want to go to X hospital, say you want to go to Lilavati or Nanavati or any other hospital in Bombay, you download their app, and then that app guides you for anything you want to do in the hospital. Right from booking an appointment, going and seeing a doctor, paying for the doctor. If you want to understand, what is the profile of the doctor, you can download and see in the app. Call centers are useless things. So the moment you call a call center, you will surely get the wrong information. So, even today I run almost 1,000 beds and I have a 50-bedded call center. But it's very difficult to get confidence because call centers also, people keep moving. So the answer is a patient app where all the information is already put. Some hospitals do have patient app, but the patient apps are not fully evolved. So technology for sales and marketing hospitals straight away, patient app. Second is a chatbot. So all the questions that you're usually going to call the call center, call the reception of a hospital, which is always very busy, and you may not get proper answers, is to have a virtual chatbot. So you go to the website of the hospital and you ask any question you want, and the chatbot is going to give you automatic replies, and they'll be accurate because you would have fed them, and technology can support the S&M department. Technology is very, very required, but the idea here is technology has to support the human effort. It is the human beings that are actually working in a hospital. The doctor, the nurse, and the non-medical staff treat hundreds of patients every day, and they are poorly supported by technology. So as a country, and as a CEO of a healthcare chain, it is our effort and my effort to ensure that we provide good technology to the staff to treat patients, because they save lives. Thank you so much.